The leadership of the Uganda Medical Association has urged medical personnel working in public health facilities to stop absenteeism and late coming and stealing from the sick. Dr. Samuel Oledo Odongo, Uganda Medical Association president, says that despite responding to their call for salary increment, many of them still spend much of their time in their private clinics.
The leaders of the Uganda Medical Association urges the medical personnel in public health facility to stop shaming them before government officials by acting as professionals in their various work across the country.
Even when you're working with these patients, can we stop bleeding of patients? It is very catastrophic for a patient to come in a government facility and you ask them for a pay. Someone will come with a hydrocele hernia, you get money from them. I assure you, you show up with that same condition, or even your parents show up. So why do you want to bring a curse on yourself? And yet the profession you're in can give you blessings instead. So let's treat our people well, let's change the health indices. We want to see maternal mortality going down. We want to see patients who are dying because of manageable illnesses going down. Let anyone who's going go in for sure. We've tried everything in our capacity.
Dr. Philbert Nyero blamed the poor performance on the incompetency of some medical personnel in government health facility and poor working relationships between them, which have costed so many Ugandans their lives.
Do not call a senior. Honestly, wake up your senior from the bed to come and see a patient you've not seen. That is embarrassing. And it is the trend we are seeing outside in the field. We have right now paid salary, but everybody is very big. They said we are striking, there is no money. We have paid. He said they have not yet come. And they say we shall continue striking. I don't know if government strength, if we could stand that.
Community members told UBC TV that the salary increment of the medical personnel in public health facility did not make any difference in the healthcare service delivery.
The medicines, the drugs which the government sends, it's not fully enough to run the health centers, to run the health units, whereby we are facing a lot of challenge of medication.
Like health workers who, some of them, they become rude.
Makosa Boniface, a pharmacist, had met witnessing a series of stolen drugs and medical equipment being sold to private health facilities.
It is very true. In many of our facilities, especially in the government facility, we have theft of drugs, we have theft of equipment, we have so many things that are happening. Now, this comes to our community sensitization. The community on priority need to understand what belongs to government is for government. If somebody is to pick a drug from a government facility, it's written government of Uganda, and sells to you, you as a citizen of this country, are you just going to buy this drug and pass a benefit to yourself or around, or you're going to pick this drug, whatever the person has brought to you, are you going to take it to make an LC to police?
The director Yumbe Referral Hospital, Dr. Oledo, says some of these problems are coming due to inadequate supply of drugs and medical equipment and scarcity of medical personnel at various health facilities.
Our staffing level is at 23%. A regional referral hospital in this country to have a staffing level of 23% is unacceptable. It is not only in Yumbe, it cuts across up to the National Referral Hospital of Mulago and Butabika. The other problem we have with the staffing is the issue of specialists. Many of our regional referral hospitals do not have specialists. A case in point in Yumbe, at the moment we have only one specialist, that is a pediatrician.
Stephen Okello, reporting for UBC TV in Gulu City.